Your liver can fail silently. Most people don't even notice until it's far too late. This condition, which takes thousands of lives every year, is called liver cirrhosis. It develops slowly, often without any pain, quietly damaging one of the most vital organs in your body. Your liver is a powerhouse, essential for your survival. It cleans your blood, processes nutrients from the food you eat, and performs hundreds of other critical functions. But when it's damaged, everything suffers. So, what exactly is liver cirrhosis? Simply put, it means your liver has permanent scarring. Think of it like this. Healthy, soft liver tissue is gradually replaced by hard fibrous scar tissue. As these scars build up, they block the flow of blood through the liver, preventing it from working properly. This damage is usually irreversible, which is a scary thought. But here's the crucial part. Its progression can often be slowed or even stopped if caught early. Early detection truly matters. The real danger is that many people ignore the early subtle signs, allowing the damage to worsen without intervention. Let's take a closer look at what causes this condition. One of the most well-known causes is long-term heavy alcohol use. But it's not the only one. Chronic viral infections, like hepatitis B or C, are also major culprits. Another rapidly growing cause is non-alcoholic fatty liver disease, often linked to obesity and type 2 diabetes, which can quietly damage the liver over time. Certain medications can be toxic to the liver if misused, and even some herbal supplements can be harmful. In other cases, the body's own immune system mistakenly attacks the liver, a condition known as autoimmune hepatitis. There are also genetic disorders that can lead to liver damage. The key thing to understand is that cirrhosis is often the end result of repeated, long-term inflammation and injury. This damage builds up slowly and silently over many years, from one or even a combination of these causes, until suddenly, symptoms start to appear. In the early stages, you might not feel anything at all. But as the damage progresses, you might notice persistent fatigue and a general feeling of weakness. You could lose your appetite, leading to unexplained weight loss, or feel nauseous more often. As the liver's function declines further, more serious signs emerge. You might see swelling in your abdomen or your legs and ankles. A classic sign is jaundice, where your skin and the whites of your eyes turn yellow. Your urine might become unusually dark, while your stools appear pale. You may find that you bruise or bleed very easily. In advanced stages, toxins can build up in the brain, causing confusion, memory problems, and sleep disturbances. Some people experience persistent itchy skin or notice small, spider-like veins appearing on their body. These are not just minor issues. They are serious warning signs that your liver is in trouble. In severe cases, cirrhosis can lead to a coma, which is a life-threatening emergency. Getting a proper diagnosis is absolutely crucial. To diagnose cirrhosis, doctors will typically start with blood tests to check your liver function. They may also use imaging tests like an ultrasound or a CT scan to get a picture of your liver size and texture. In some cases, a liver biopsy, where a tiny piece of liver tissue is removed and examined, is needed to confirm the diagnosis. Cirrhosis leads to serious complications. One is portal hypertension, which is high blood pressure in the vein that enters the liver. This can cause fluid to build up in the abdomen, a condition called ascites, and can lead to dangerous internal bleeding. People with cirrhosis are also more prone to infections, and their risk of kidney failure and liver cancer increases significantly. The buildup of toxins that affects the brain is called hepatic encephalopathy. This is why regular monitoring is so important. It saves lives. Treatment will depend on the underlying cause and the stage of the disease, but lifestyle changes are always essential. So, how can you prevent this or manage it? First and foremost, if you drink alcohol, it's critical to stop completely to prevent further damage. Get treated for chronic hepatitis if you have it. Maintaining a healthy weight through a balanced diet and exercise is key to preventing or reversing fatty liver disease. If you have diabetes, keeping your blood sugar under control is vital. Focus on eating liver-friendly foods like fresh fruits, vegetables, and whole grains, while avoiding processed foods high in fat, sugar, and salt. Be cautious with medications and supplements. Only take what's necessary and prescribed by your doctor. And finally, don't skip your regular medical checkups. Early action saves lives. Your liver works hard for you every single day. Take care of it. If you found this information helpful, please like, share, and subscribe for more health education to help you live a better and healthier life.